How can you spot the signs of a heart attack before it's too late? Welcome to Health Topic, your best health-related news content channel in the world. Today, we'll be explaining to you what is heart disease and how you can spot the signs. You'll find out how you can reduce its risk as a bonus, so make sure to stay until the end to find out our secret technique. Also, don't forget to subscribe and turn notifications on to receive more fantastic health news like today. So, what is heart disease exactly? Heart disease describes all the conditions that can negatively affect your heart. Just to clear it up, heart disease is more like an umbrella term. It's not just one disease that affects the heart, but a whole assortment of ailments that can afflict anybody. Diseases under the heart disease umbrella include blood vessel diseases, such as coronary artery disease, heart rhythm problems known as arrhythmias, and heart defects you're born with, called congenital heart defects. Heart disease is not precisely a cardiovascular disease, as these terms are often exchanged and that can generate a bit of confusion with both of them. Cardiovascular disease only mean conditions that affect narrowed or blocked blood vessels, which lead to the infamous heart attack. It also includes chest pain or even stroke. There are other heart conditions that aren't centered in the blood vessels, affecting the heart's muscles, rhythm, and even its functioning. Unlike other types of diseases, most forms of heart disease can be prevented or treated if you undergo a healthy lifestyle. We'll go through ways to identify it and some quick tips on how to prevent it from being a serious health problem in your current life or in the future. You might be surprised to find out that cardiovascular disease symptoms, such as atherosclerotic diseases, affect both men and women differently. Men tend to have chest pain, and women have symptoms such as shortness of breath, nausea, and seemingly out of nowhere fatigue. In general, symptoms of heart disease might include chest pain, tightness, and discomfort. The scientific name for this symptom is angina, and it also comes along with its mean cousins, which are pains in the neck, jaw, throat, upper abdomen, or back. Now, these symptoms might seem similar to any other kind of disease that might affect your body, such as a stomachache or a respiratory affliction. That's precisely why you must constantly check in with your go-to doctor or medical professional to pinpoint exactly what's happening to you, and a good starting point for this is spotting these symptoms from the beginning. You might not be diagnosed with cardiovascular disease until you have your first heart attack, stroke, or heart failure, most of which are extremely deadly. With early regular evaluations, cardiovascular disease can be spotted on time and treated properly. Let's take a look at some examples of heart disease. Abnormal heartbeats are known as arrhythmia, in which your heart may beat too quickly, too slowly, or irregularly. It also includes other minor symptoms that can be easily spotted due to how they manifest in our bodies. For example, if you feel constant fluttering in your chest, and either racing or extremely slow heartbeat coupled with chest pain, dizziness, and fainting, then there's a high chance that you might be experiencing heart arrhythmias. Heart disease symptoms could also be caused by heart defects, known as congenital defects. These are spotted almost immediately after birth, so if you're watching this video and haven't been diagnosed with one of these, then there's a high chance you don't have one in the first place. Heart defect symptoms include pale gray or blue skin color, swelling in the legs, abdomen, or the area around your eyes, shortness of breath in infants, and easily tiring during exercise. Then, we have what's called dilated cardiomyopathy, easily translated as a weak heart muscle. This one is a condition in which the heart becomes enlarged and cannot pump blood effectively. Symptoms vary from none to feeling tired, leg swelling, and shortness of breath. It could result in chest pain or fainting. Complications can include heart failure, heart valve disease, or an irregular heartbeat. Only about 1 per 2,500 people are affected by this condition, and it's more frequent in men than women. It tends to begin in the middle age, and the 5-year survival rate is about 50%. So, how do we identify a heart attack? You should be able to contact an emergency line such as 911 at any moment if you have been diagnosed with any kind of heart disease. Symptoms might include chest discomfort, discomfort in other areas of the upper body, shortness of breath, and also breaking out in cold sweat, nausea, or lightheadedness. Some heart attacks are sudden and intense, but most of them begin with mild pain or discomfort. As with men, women's most common heart attack symptom is chest pain or discomfort. But women are somewhat more likely than men to experience some other common symptoms, especially shortness of breath, nausea or vomiting, and back or jaw pain. Know that minutes are extremely important, and even if you're not sure it's a heart attack, call an emergency line if you experience the warning signs. An emergency medical services team will begin treatment immediately, and they are trained to revive someone whose heart has stopped. However, as with many diseases, prevention is usually the best form of treatment, and you can reduce the appearance of heart disease in your body if you take the necessary measures to keep a healthy lifestyle as a big part of your life. Let's take a look at some tips you can follow to reduce your overall risk of heart disease. Understand that heart disease risk increases with age, usually at the middle age for men age 45 and older, and women age 55 and older. On top of that, African Americans are more likely than Caucasians to have heart disease, while Hispanic Americans are less likely to have it. Within Asian groups, such as East Asians, have lower rates, but South Asians have higher rates. First, you should know that high blood pressure is an important risk factor for heart disease. It is imperative for you to get your blood pressure checked regularly. We advise at least once a year for most adults, and more often if you have high blood pressure. Take the necessary, including lifestyle changes, to prevent or control high blood pressure. Also, make sure to lower your cholesterol levels, as these work day and night to increase your risk for cardiovascular disease. Try not to clog your arteries and instead consume a healthy diet very low in cholesterol and other bad substances for your heart health. Make sure to keep yourself at a healthy weight. Being overweight greatly increases your risk for heart disease, as they are linked to other heart disease factors, such as high blood pressure, diabetes, and blood cholesterol. Make sure to have a healthy diet to do all of this. Try to limit saturated fats, foods high in sodium, and added sugars. Eat plenty of fresh fruit, vegetables, and whole grains. This will help you keep your body healthy and also lower your risk of high blood pressure. You should also greatly limit alcohol and smoking. Alcohol makes you fat, makes you handicap and do dumb things, and even affects your heart disease rate. Men should have no more than 2 alcoholic drinks per day, and women should not have more than 1. Smoking is no better. It raises your blood pressure and puts you at very high risk for heart attack and stroke. If you want a healthy heart to live a longer life, quit smoking as fast as possible. Stress is also linked to heart disease, and experiencing high levels of stress for a prolonged amount of time will raise your blood pressure. Try to meditate, exercise, listen to music, and avoid stressful situations. Getting good sleep is also imperative to manage your stress and decrease your rate of heart disease. If you don't get enough daily sleep, you'll increase your risk of high blood pressure, obesity, and diabetes. These things can increase your risk of heart disease greatly. Most adults need 7 to 9 hours of sleep per night. Make sure that you have good sleep habits. If you have frequent sleep problems, contact your healthcare provider. One problem is, sleep apnea causes people to briefly stop breathing many times during sleep. This interferes with your ability to get a good rest and can raise your risk of heart disease. So, what did you think of these tips? Did you find them useful? Let us know in the comments below. Also, don't forget to leave us a like, share this video, and subscribe to Health Topic to keep receiving more exclusive health content like you did today. We hope you enjoyed our video, and we'll see you next time.